Hi, I'm Rose from Scolicare, and today we'll be exploring de novo degenerative scoliosis, what it is, why it develops, and how we can support it without surgery. Degenerative or adult onset scoliosis occurs when age-related changes in the spine, like the disc wear, joint arthritis, or muscle imbalance, cause the spine to curve over time. It's especially common in people over the age of 50 and can lead to leg pain, back pain, fatigue, and reduced quality of life. The encouraging news is we can treat this in a non-surgical manner for most of our patients. As we age, the discs between our vertebrae naturally thin and lose height. And when one side wears down faster than the other, the spine begins to tilt or rotate. At the same time, the spinal joints may degenerate and become arthritic, again, often more on one side than the other. And this can contribute to a curve developing and progressing. Meanwhile, the muscles that help support the spine can also lose strength and endurance over time. All of these changes may lead to symptoms such as back pain, nerve irritation, a sense of heaviness in the legs, or difficulty standing fully upright. The aim of non-surgical treatment isn't to reverse the aging, it's to restore postural balance, reduce strain, and help the patient feel more supported in everyday life. So, can degenerative scoliosis be treated without surgery? Yes, many adults successfully manage de novo degenerative scoliosis without surgery, with non-surgical care focusing on improving comfort, mobility, posture, and overall daily function, and even reducing the risk of falls. At Scolicare, our treatment approach typically involves bracing and a targeted specific exercise program called Scoliobalance. The aim is to provide support and improve quality of life and get you back to your everyday function. Modern 3D braces, such as the ScoliBrace, can be an effective part of managing degenerative scoliosis. The brace isn't meant to be aggressive or reshape the spine completely. Instead, we work by trying to gently redistribute pressure, offering external support, reducing strain on the overloaded joints and discs. For many adults, bracing can really help. It can relieve pain and fatigue during daily activity and even reduce the risk of falls as we age. Supporting the posture and breathing mechanics and improving stability when walking and standing is an important part of the program. Most people wear their brace part-time as an adult, during activities of the day when they really feel they need the most support. Scoliosis-specific exercise is also a key component of this long-term management plan. Approaches such as the Scoliobalance program are designed to strengthen the muscles that support spinal alignment in a 3D manner. The program aims to reduce stiffness and muscle tension, improve mobility and balance, and postural control, build your core endurance, and support weaker areas of your spine. With regular practice, people often feel more confident in their movement and less reliant on pain-driven habits or compensations. Surgery is typically considered only when symptoms are severe, such as when there is significant nerve compression that limits daily function, or where the curve becomes large enough to impact mobility or overall health. Even when surgery is on the table, non-surgical care still has an important role. It helps repair the body before the surgery and helps with the recovery afterwards. And for many adults, a well-structured non-surgical plan provides meaningful improvement without the need to pursue surgery. Through a combination of 3D bracing, tailored exercise, and ongoing monitoring, many adults manage their symptoms effectively and stay active. At Scolicare, we're committed to providing evidence-based, personalised care, supporting confidence, comfort, and control at every stage of the treatment plan. Thanks for joining me today.